audiogram of a 70-year-old patient that I'm going to explain to you. They have a normal hearing up to 500 hertz, then mild sloping to profound sensory neural hearing loss bilaterally. So if you look at this left-hand side, you'll see the decibels increasing by increments of 10, and this is just the measurement for the hearing level or the sound intensity. So first you'll see 0 to 25 decibels is considered normal hearing. So this patient has normal hearing up to 500 hertz. Then it'll start to decrease a little bit. So at 1000 hertz, it hits 30 decibels, and that's now a mild loss, which just means that the patient will need to turn up the volume a little bit in order to hear sounds at that frequency. And then we'll continue decreasing. At 2000, it hits 50 decibels, and that's now a moderate loss, which means that the patient will have to turn up the volume quite a bit in order to hear those sounds. And then it hits at 4000 hertz, about 65 decibels, which is moderately severe. And this means that the patient will need to turn up the volume extremely loud in order to hear anything at that frequency. And lastly, at 5000 hertz, it hits 90 decibels, and this marks a profound hearing loss, and that means that they won't be able to hear anything from that frequency or above. So these lower frequency sounds they're able to hear, and their hearing progressively decreases as we increase the frequency. So those lower frequency sounds that we use in speech, like the vowels, ah, ah, o, they will be able to hear those, but as we increase the frequency, which we'll hear more of in the consonants that we use, those are going to be lost. So they'll have some input, but not all of it, which makes understanding speech really difficult, although they can hear some of it. And this will also contribute to them having to increase the volume on a TV, because they'll be hearing those lower frequency sounds, but during dialogue they won't be able to hear those higher frequencies. So they'll have to turn up the volume super loud in order to hear or understand what's going on the TV. You'll also see that there's two different lines. There's the red and the blue. The red is representing the right ear, and the blue is representing the left ear. And you can tell that they're pretty closely aligned, which is why it is considered bilateral, meaning it's in both ears. They're hitting the same decibel levels at each of the frequencies, so it's going to be the same in both ears. And then lastly, I mentioned earlier that it was sensory neural hearing loss, which means that the location of the loss is in the inner ear, which you'll also hear as in the cochlea as well. And this type of loss that we see sloping down is common in adults as they age, or older populations. And it is permanent, but we have some audiologists that can review management strategies to make hearing a little bit easier, and also just future steps